This is Marina Coleridge, Enterprise Systems and Analytics Manager for the Health Service System, presenting to you the risk scores for the San Francisco Health Service System population. Risk adjustment is a statistical process that uses predictive models to turn healthcare data into risk scores. Scores correlate with the cost of an individual's underlying illness burden. Aggregating the scores of individuals generates group-level results that can help predict the future cost of healthcare, assess performance, measure efficiency, and assess the disease burden of the population. The concurrent models, also known as retrospective, measure the current illness burden of a population, and this includes chronic and current acute conditions. Acute conditions are severe and sudden and could describe anything from a broken bone to an asthma attack. Symptoms develop quickly and the condition is expected to be brief, typically resolved in less than 6 months. The concurrent model provides an assessment of what costs should have been for members given their health conditions. Prospective models predict what costs will be for members in the future. This model measures the chronic condition illness burden since that affects future costs. Chronic conditions are long-developing conditions which typically have a slow onset and worsen over time. These conditions persist over 6 months and are generally not curable but can be managed, such as diabetes or high blood pressure. This score provides the ability to predict future healthcare spending. Current acute conditions are relatively less important since they don't affect the future cost. For this model, members with no claims receive a risk score based on age and gender. This study evaluates the risk scores based on the time period of October 2018 to September 2019, and the previous time period would be October 2017 to September 2018. Financial information is not available for the Medicare population. Our analysis revealed that the largest percentage increase in both concurrent and prospective risk scores were for active employees and their dependents. The concurrent risk score increased by 3.71%, and the prospective risk score increased by 1.98%. Claims experience from actives enrolled in United Healthcare and Kaiser Permanente drove the increase. In our early retiree population, the concurrent risk score for those enrolled in the Blue Shield plans decreased, and the prospective risk scores for those in Blue Shield saw a very slight increase. In our Medicare population, the concurrent and prospective risk scores increased over previous period. Evaluating plan performance and adjusting for risk score, United Healthcare PPO, Blue Shield Trio, and Blue Shield Access Plus PMPY costs are all higher than expected, while Kaiser Permanente's PMPY adjusted cost was lower than expected, with 2% of the commercial population driving 78% of the costs. Consistent with the findings from previous year, musculoskeletal disorders are the clinical condition which is the largest driver of the prospective healthcare risk. This slide compares the predicted health risk to the actual. Here we see that in 2019, the 0.978 concurrent risk score for actives was still well below the 1.059 prospective risk score prediction from 2018. Despite the increases, the 0.978 score is still well below the average annual cost per an individual, which is represented by a score of 1.0. Here we see the same is true for the early retirees. The 1.992 concurrent risk score in 2019 was below the 2.102 prediction from 2018. In our Medicare population, we see that the concurrent scores of 5.192 are higher than the previous year's projection of 4.758. This is indicative of the possibility of acute exacerbation of chronic conditions. Here we see the prospective and concurrent risk scores broken out by plan. The orange lines are the concurrent and prospective for early retirees, and the blue lines apply to actives. Kaiser Permanente concurrent risk score of 0.880 for the active population is well below the average beneficiary of 1.0 and better than the projected score of 0.975 from the previous year. As mentioned in our overview, prospective and concurrent risk increased over the previous period. In our United Healthcare PPO City Plan members, these risk scores represent the highest risk amongst the SFHSS commercial population. Prospective risk scores for the active population enrolled in TRIO remained flat and decreased slightly for early retirees. The Access Plus plan, the early retiree population concurrent risk decreased, and the prospective risk rose by 0.22%. While the active population had increases in risk scores in the Access Plus plan, the risk for the retirees is twice that of the actives. Here we see the blended concurrent and prospective risk scores where the active and early retiree risk has been combined. Moving into our Medicare plans, the prospective risk score in orange is much higher for those enrolled in the Kaiser population, 4.957 to 4.707. And within the United Healthcare population, the concurrent risk score of 5.354 is significantly higher than the 4.996 in the Kaiser Permanente Senior Advantage population. Here we evaluate plan performance where the allowed amount of cost for medical and pharmacy claims have been adjusted dynamically based on risk score. Here we see that UHC, Blue Shield Access Plus, and Blue Shield Trio all have an actual PMPY higher than expected based on that adjustment. Whereas for Kaiser Permanente, we have actual PMPYs lower than expected based on risk adjustment. Here we have our members in our commercial population banded into risk categories from healthy to in crisis. Healthy patients are infrequent or non-utilizers, all the way to in crisis patients who are very heavy utilizers, often being treated for multiple severe acute and chronic conditions. 2% of the commercial population is driving 78% of those costs. Here we see the member distribution by plan and risk category. So on the left is the total of all the plans that you have just seen in the previous slide, and here's the breakout for you for each of our commercial population plans. And here's the allowed amount per member per year distribution by plan. Again, between 77 and 79% of costs are being driven by those that are in crisis. And here's a look at the conditions and disorders by those wristband profiles. In each wristband, the top 5 conditions are laid out for you with musculoskeletal disorders represented in each risk category, and it's the top contributor in 4 out of the 5 categories. In further analysis of those that were continuously enrolled between 2017 and 2019, our findings are that 23% were now in a lower risk category, 49% are at the same risk, and 28% are at a higher risk category. Within the wristband profiles of the Medicare population, we see musculoskeletal and cardiovascular disorders prevalent in each of the risk categories. Comparing the continuously enrolled Medicare members between 2017 and 2019, our findings are that 19% are in a lower risk category, 50% are in the same risk, and 31% are in a higher risk. As a reminder, risk scores don't predict clinical conditions, just the likelihood of incurring expenses in future or current years. The lower risk score could indicate conditions that no longer require treatment, or it could also point to gaps in care. Using risk adjustment, we can compare plan performance. Here we've based it on inpatient admits per 1,000, a utilization metric, because we don't have the financials for the Medicare retirees. Those plans that experience some changes from previous year ratio are outlined in red. Plans with a ratio of 1.0 or less are performing right at performance or better. And within the early retirees, the United Healthcare PPO City Plan has a ratio of 1.1, which indicates admits are higher than expected based on risk adjustment. Exploring cost and utilization by relationship within the commercial population, we find that spouses and domestic partners have higher utilization and PMPM costs. Within the Medicare population, the subscriber incurs more of the utilization. Not surprising, given that most of Medicare retirees are retiree-only enrollment. Hierarchical condition categories map patients' historical diagnosis to produce a risk adjustment factor used for Medicare reimbursement. Here's a look at our Medicare retiree population. For the first time, we're able to apply hierarchical condition categories to the non-Medicare population. In the top right, we see the early retirees enrolled in United Healthcare and Blue Shield plans. Members in these plans predominantly migrate into the United Healthcare Medicare Advantage PPO. In the lower left, we have early retirees enrolled in Kaiser Permanente, and individuals enrolled in these plans predominantly migrate into the Kaiser Permanente Senior Advantage plan. As you can see by percentage, end-stage renal disease is the more prevalent condition in the early retiree population. Please note, however, the total early retiree population of approximately 9,700 is a third of the Medicare retiree population. And finally, here's a quick look at our risk by age and gender.